Good afternoon, ladies and gentlemen. Welcome to the City of York Council Health and Adult Social Care Policy and Scrutiny Committee. Today is Tuesday, the 11th of May. I should point out that this is not a formal meeting of this Scrutiny Committee. The Council is currently operating its scrutiny and decision-making meetings in accordance with statutory requirements relating to holding COVID-safe meetings between the 7th of May and the 21st of June. As non-decision-making bodies, member of this Council's scrutiny committees will continue to hold public informal sessions remotely for the purpose of commenting only on the business set out in the agendas, which is what we'll be doing today. We're not a decision-making committee as such anyway, so I don't imagine we'll see a huge amount of difference in this respect. But it was important, I think, that was noted. In terms of declarations of interest, do any members have any declarations they want to put forward at all? No, not seeing any indication. The minutes of the meeting on the 13th of April are on the pages 1 to 8 in the agenda. Do members have anything they wish to raise from the minutes, please? Councillor Hook.
Yes, the Vice Chair isn't Councillor Orrell. It got, which page is it? It was the bit when the system crashed. It said on page 6, it said between 1930 and 1905, the Chair lost connection and Councillor Orrell stepped in. And it was Councillor Cullick.
Right.
So I did read it.
Well done. So if we can just have a correction to that, please. Anything else, members? I do want to make make a point, and it's a point that I've made on several occasions over the years, actually. It's not something specific to this administration. I want to make that clear. It's not a political statement, but I do think following the Mazars report that we should be making minutes clearer in terms of attributing questions and speakers names in terms of accountability. And I just want to make that point that I think that's something the council should be doing, generally speaking. There are a number of incidents throughout the minutes where, for instance, it says members raised concerns regarding, but it doesn't say who or whether it's all or some. And likewise, in terms of responses, or page 5, for example, lower down, it says members raised some concerns regarding accountability. And in answer to some questions raised, it doesn't say about answers to other questions that were raised. And I just think and again, it's not something that I'm criticising our officers that are taking the minutes. It's a style that the council's asking our officers to write the minutes in. I think it leaves something lacking. And it's a view I've made several times, and I want to make it again, particularly after the recent Mazars report. Councillor Taylor.
Thanks, Chair. Just to entirely support what you're saying, really. But my question would be, how do we go about changing this? Is it through the chairs of scrutiny committee? Because you're right, you have raised this a fair few times for as long as I've been a councillor, and I've raised it a couple of times myself. And aside from accuracy, it's important that residents see which councillors are actually asking questions in committees, because a lot of the time, many councillors don't say a word 2 or 3 hours. But it'd be good to sort of take this somewhere and get an outcome from it, if at all possible.
Yeah, I agree, and it will be so. Next time I'm at the scrutiny chairs meeting, I'll mention it again. I have mentioned it there before. I've also mentioned it and written to Democratic Services about it before, and it's not something that's been universally accepted as, shall we say, in terms of agreement. But I do think it's something that, you know, is important in light of what may or may have occurred in the past and what could happen in the future. And I think it's something that I think we should be doing. As I say, it's not a political statement, because it's something that it's been like this for many years. Councillor Culloch.
Thanks, Chair. And I'm not saying this to disagree with you at all, but for the sake of members of the public who might be watching, just to say, and stating the obvious really, that this live stream does remain on the council website and does remain as a permanent record of all their meetings. So if there is any doubt about which councillor has asked which question, or who's contributing and who's not contributing, it's very clearly there on the record through this recording of every meeting.
Yeah, I appreciate what you're saying, but we shouldn't be having to go through sifting past webcasts for, you know, looking for information, potentially for information should it be required. I mean, that's literally like looking, you know, for a needle in a haystack. So I wouldn't, you know, although you're correct in what you say, I don't think it's necessarily an easy way to find in the future potentially. But thank you. If there are no more questions or comments about the minutes, we'll move on. So we don't have anyone registered in public participation today, so we'll go straight to the first agenda item, and it's Sharon Stoltz, our Director of Public Health, presenting an update on public health update on COVID-19, and she's kindly prepared some presentation slides which we'll hopefully have up in front of us and for the members of the public that are viewing to see as well, hopefully, in the next few minutes. Sharon.
Yes, thank you, Chair. And I understand somebody is going to put the presentation up on screen for us. While that's being done, thank you. There it is. Thank you. I'll just say that the situation with COVID, as members will be aware, is changing daily. So as I go through the slides, I'll update you with today's data, so that you can see the difference between when this presentation was prepared at the end of last week to today. So on to the next slide, please. So there are two graphs here. The top one shows the trend of the virus. And as you can see, we had a very large peak in the beginning of the year, which fell quite rapidly and has been a bit bumpy over the last few weeks. So as of today, the provisional rate of COVID is 15.2 per 100,000, and that represents 32 cases, and which takes us up to the 9th of May. That's the provisional rate. The validated rate up to the 4th of May. So it takes a little bit longer for us to make sure that all of the cases have been captured and entered onto the system, is 15.7, which is 33 cases. That compares very favourably, that rate of 15.7, with a national rate of 21.4 and a regional rate for Yorkshire and Humber is 42.2. So as you can see, there has been some variation in the numbers that are reflected here. And this is really because our cases at the moment are hovering around 30. And so a difference of just 1 or 2 cases can make a difference to the rate that we see, which is why we've started quoting case numbers, not just rates. If you look at the graph underneath then, that shows where York sits in comparison with other local authorities in the Yorkshire and Humber region. For a while, we were at the bottom of that list with the lowest COVID rate. As you can see, North East Lincolnshire has overtaken us, and they have the lowest COVID rate at the moment. So going on to the next slide, this shows us what has been happening with the over 60 age range. Members will be aware, we've discussed this before, one of the reasons that we do look very carefully at what's happening in COVID in people over 60 is because we know that there is an age-related element to people becoming very sick and needing hospital administration, hospital treatment for COVID. And I'm very pleased to say that our COVID rate in the over 60s has fallen, largely down to the success of the COVID vaccination programme in York in this age group. So today's data, the most recent data, which takes us up to the 3rd of May, so the data in front of you goes up to the 29th of April. There were 6 cases then. That has actually fallen, and we have a rate of just 6.1 per 100,000, which is just 3 cases. So as you can see, a very positive picture in the over 60s age group. So moving on to the next slide, this graph shows what's happening with our positivity rate. And so York is the red line again, the regional green, and the England average is the dark blue there. So what you can see from this is that our average over the last period has been considerably lower than the regional average. We spent quite a bit of time below the national average, but we are, based on this slide, are just above or the same as the national average at the moment. And that really hasn't changed very much. Our rate at the moment is significantly below the regional, but not significantly different to the national rate at the moment. So moving on to the next slide. This, so members will remember from previous conversations that we don't just measure case rates, we look very carefully at a range of information. So we look at case rates, we look at hospital admissions, we look at the number of people that are contacting NHS 111 with symptoms of COVID. We monitor the Zoe app, which is self-reported symptoms. And we also now measure wastewater sampling for picking up any COVID particles that are found in wastewater. So we get that information from the Water Authority. So the slide that's in front of you, that graph shows NHS 111 triages. And that's a more positive picture based on today's data that takes us up to the 6th of May. So there have been 100 COVID triages in the York area in the last 7 days. And what we've seen with water sampling reflects really what's happening with the number of people ringing 111. So when we look at the water sampling results, it showed that there was an increase in cases of COVID in York round about April time, but since then the numbers have fallen and are staying fairly stable at the moment. And that does reflect the data that we're seeing from other sources as well. In terms of the Zoe app, that's a research app. We have just under 4,000 residents in York registered with this app. And based on that data, it gives us a rate of 26 per 100,000 population showing symptoms at the moment. A number of those will be people that have been suffering with COVID symptoms over a number of weeks or months. And so we monitor this data as well, because it helps give us a picture of how many people across York might be suffering with long COVID, which members will be aware of those people who unfortunately find that even if they've had a mild case of COVID, they may be left with debilitating symptoms for weeks or sometimes months afterwards. On to the next slide, please. So this shows us where we are with hospital admissions. Again, there's always a delay with this data coming through, but I can say that as of the 4th of May, which is the most recent data, there were no people, no patients with COVID in general and acute beds at York Hospital, and just one patient in intensive care. And so again, a positive picture in terms of hospital activity at the moment. On to the next slide, please. So members will be very familiar with this slide. We've seen it on a number of times before. It shows us what's happening with deaths related to COVID, that where COVID has been mentioned on the actual death certificate. But more accurately, we also measure excess deaths, which gives us a more accurate picture of any excess deaths. And as you can see, since the start of 2020, which is when we started collecting and monitoring this data, there have been 168 excess deaths. Not all of those will necessarily have had COVID mentioned on the actual death certificate, but it just gives us an indication of the wider impact that COVID has had on death rates in York across that period. On to the next slide, please. So this shows where we are in terms of cases in residential care settings, so care homes, and amongst school children. So we've had a very positive picture in our care homes for some weeks now. And based on the most recent data that takes us up to the 7th of May, again, we're in a fabulous position of not having any care homes in the York area with confirmed COVID infection. And our last outbreak was still the 25th of February. So that reflects the success of the vaccination programme, but also all of the hard work that our care home staff and visitors have done really to keep those infections in care homes under control. So that's a very positive picture. Similarly, in school, the position hasn't changed. So there's a bit of a delay with getting this data through. So the 3rd of May is still the most recent data that we have. But we monitor it on a daily basis. So we get notified of any positive cases or outbreaks in schools in York, and those numbers continue to be very low. On to the next slide then, please. So this shows us the number of new COVID cases over the last 7 days by age. And as you can see there, we are still seeing the highest numbers of cases in the 20 to 29 and 30 to 39 age group. Obviously, this is the age group that has not yet been invited for COVID vaccination. As the vaccination programme extends to younger age groups, then hopefully we'll start to see a reduction in the number of cases in those age groups. On to the next slide then, please. This isn't easy to read, but basically it's a breakdown by electoral wards across the city of where we can see cases. And one of the reasons I wanted to share this is those of you, including anyone watching, who have been monitoring the ward rates, they can change quite a lot from week to week. And quite often it only takes 2 or 3 cases for the ward rate to change quite a lot. And so this shows you the numbers of cases. So this is the most recent week we've got data for, which takes us up to the 22nd of April. And as you can see, across all of the wards, we have a number of wards now that have had no cases during that period, and the maximum number that we saw in any ward was in Clifton, which had 7 cases. So this hopefully particularly for elected members, but residents as well, helps to put the ward rates in better context for you. So on to the next slide, please. This is an indication of what's happening with the vaccination. So this is COVID vaccination at the moment. So as at the 9th of May, we'd given over 105,000 first vaccines in York, and we've given over 54,000 second doses. That represents that we've got just under 61% of adults now vaccinated in York with their first dose, and over 31% with their second dose. Clearly, what you can see is quite a lot of variation in numbers here, which largely relates to the timescale of the vaccination programme. So as you can see, an excellent take up there in people over 80, in those older age groups. And then as we come down to the younger age groups where the vaccination programme is still being rolled out, and there's lower uptake there, but we continue to monitor this. And as the weeks go by, we should start to see the uptake in those lower age groups pick up as well. On to the next slide, please. So this graph just shows the continuing success, really, of our local contact tracing programme in York. The date in, you can see the increase up to over 90% when we started taking over contact tracing in York, and we continue to complete around 94% of cases, which is really positive. It's one of the highest success rates in the country. On to the next slide, please, then. Thinking about the roadmap and moving towards recovery. So you'll all be aware that next week on the 17th of May, the Prime Minister has announced that we will be progressing to stage 3 of the roadmap. This means that we go back to the rule of 6 or 2 households indoors. Groups of 30 will be able to meet outdoors. Hotels and bed and breakfasts will be able to reopen, and so will outdoor and indoor entertainment. But these venues still need to be COVID secure, so there may be some limits as to capacity with some outdoor and indoor events. At the moment, stage 4 of the roadmap is forecast for the 21st of June. It says here all restrictions will end, but that is still subject to a number of reviews that are being undertaken at the moment. So there are reviews taking place at the moment of social distancing, of face coverings, and so there is a possibility that even when we get to the 21st of June, there'll be some restrictions still in place. The government will be wanting to review the impact of stage 3 before it announces the definite end of restrictions for the 21st of June. So this is my final slide. I wanted to say something about where we are with COVID recovery at the moment. So we're moving into the phase of the pandemic now, which is about learning to live with COVID. Despite some of the headlines in the national press and social media over the weekend, the pandemic hasn't gone away. It's still very much with us. As you've seen from the data I've shared, we're still seeing new positive cases every day in York. And there are concerns that I'm sure you will have read or heard about new variants coming into the country, including the Indian variant, which is very topical at the moment. But nevertheless, we are anticipating that our recovery will continue, but with some safety measures are likely to continue, dependent on the government review. So I've mentioned social distancing and face coverings. The government are also reviewing asymptomatic testing. So at the moment, we're advising all residents of secondary school age and above to be tested for COVID twice a week. And that's still very much national policy, and we're doing very well on that in York. There is a review being undertaken of asymptomatic testing, and so we'll wait and see if government policy changes on that. But at the moment, particularly with COVID variants circulating, it's important that people continue to be tested. The NHS is busy restoring its services at the moment, but I think, as we discussed at the last Scrutiny Committee, there are long waiters. So the waiting list has grown for a number of elective procedures. And so there will be people in York that will find themselves possibly in pain on a waiting list for surgery. Our NHS colleagues are busy triaging all patients that are on the waiting list at the moment, including with GP practices, to look at which patients are safe to remain on the waiting list and who need to be, which patients need to be brought forward. But that inevitably is going to have an impact on a significant number of residents. We've heard about building back better, but we also need to build back fairer. So we know that COVID will have exacerbated existing health inequalities across the city. So that continues to be a key focus for us going forward. Amanda may want to say a bit more about this, but we know that children and young people have been greatly impacted not necessarily directly by becoming infected with COVID, but about the impacts of the measures to manage and control COVID. So we know that young children, preschool children, have been impacted, particularly through lack of social contacts. Young children won't have had the same exposure to extended family. They won't have been to play groups and nurseries, etc., that they might have been in the past, those informal networks. And so there are some national studies that show that impacts such as speech and language delay, but including mental health in children, young people, but of course adults, has been been a major kind of fallout really of those COVID control measures. So these are all areas that we particularly want to focus on as we move into recovery. So that's the end of my presentation, Chair, but of course we'll be happy to take any questions.
Thank you very much, Sharon. Seems comprehensive as ever. I think obviously, it's, as far as I'm concerned, it's the roadmap progression is very welcome. But clearly, we can't be complacent, and you make some somber but very appropriate points about some of the elements that that we're going to be stuck with for some time around patient lists, waiting lists, and effects on mental health and on many of the children in York and nationally. So obviously we've got those to think about. I was a little bit disappointed in the vaccination figures to see that not all NHS workers and social care staff have taken up vaccinations, and indeed I think the figures were even worse amongst care workers. So I don't know whether what the health authorities are doing about encouraging. I would have hoped we would have had universal take-up really, and it's disappointing to see we're not at that stage with that. Would you know what's being done in those efforts, Sharon?
Yeah, so first of all, I suppose there's a bit of a public health warning on this data in that there may be some health and social care workers that have been counted in the other age groups. So this data, I would put a public health warning on it. It's the best data we've got, but it isn't perfect by any means. So it's not necessarily 100% accurate. However, COVID vaccination, all vaccinations in this country is voluntary. And so whereas we would strongly encourage, and we've been working together across health and care organisations to try and strongly encourage, particularly frontline staff, to have the COVID vaccination, it is choice. There isn't anything that we can do to mandate that health and social care staff take up the vaccination. And you'd see a similar picture here if we were looking at seasonal flu vaccination, which of course is offered to health and social care staff every winter. There isn't universal take up of seasonal flu vaccination either. So we're doing everything we can to encourage that. Obviously our COVID risk assessments are still in place. It's not just vaccination, it's the use of appropriate infection control measures, the use of personal protective equipment. You know, vaccination is one of the tools that we've got in our toolbox, but there are all of those other things that need to be taken into account as well. It is disappointing, I would agree. The picture in York isn't so different to the picture that you would see nationally. In fact, our uptake amongst health and social care staff is better in York than it is in some places. But I'm sure everyone watching would share your concerns, Councillor Doughty, and in an ideal world everybody would be vaccinated, but there is that choice, so that inevitably plays into some of the figures that you see here.
Thank you. And just before I open up to the members talking about the points of vaccinations, just wonder how we're getting on in terms of encouraging take up in some of the wards where we definitely had significantly lower take up, some of the more, shall I say, potentially more deprived areas of the city. How are we getting on in that respect?
So there's a lot of work happening with that, and the Outbreak Management Advisory Board is now monitoring the uptake of vaccination by ward. There is a vaccine inequalities group that's been established. We have one in York. There's a shared one across primary care across North Yorkshire and York. And there's a Humber Coast and Vale integrated care system vaccine inequalities group as well. What that shows is that the reasons for variation in uptake in vaccination is the same. There's nothing that's unique to York. The issues that crop up are very similar, and it's partly around ensuring that residents get the right information. There's a lot of misinformation out there, particularly on social media, so it's using every means at our disposal to get the right information to people so that they can make an informed choice for them personally whether they want to be vaccinated or not. And access to vaccination is also an issue, so not everybody can travel. Not everyone feels comfortable going to a large vaccination site like Ascot Bar, for example. So there's a lot of work that's going on with individual GP practices in those parts of the city where we have lower uptake. And there's work now starting to happen with community pharmacies as well, particularly those who routinely offer the seasonal flu vaccine every year, to look at how they can start to offer vaccination closer to home. And then there's also practical work happening around the timings of vaccine. If you have a job, it can be difficult to get to a vaccination centre at a particular time. So we're looking at as much flexibility as we can build in to the vaccination programme to make it as easy as possible for those people who want to have a vaccine, that they're able to have it, while not stigmatising those who, for various reasons that are personal to them, might choose not to be vaccinated. It is patient choice, so we need to be mindful of not chasing people into the ground to be vaccinated if they've already said no thank you, I understand the risks, but I choose not to be. So there's a huge amount of work that's going on, but if any elected members have any questions about what's going on in your individual wards, then please contact me and I can let you know any specific work that is happening in your particular wards, so that it might help you with conversations that you might be having with constituents.
Thank you very much, Sharon. Right, I think most of the members have indicated that they have a question. I should say at this point, I should have mentioned it earlier, but we did get apologies from Councillor Perrott, and I think it was fairly late notice, so there's no substitute for Councillor Perrott. It's the first question from Councillor Heaton, then Councillor Culloch, please.
Thanks very much, and thanks, Sharon, for the report as ever. It's very detailed, very useful. I should say, before I get into my question, actually, just in terms of people with work and being able to actually access the vaccine, I would hope employers do actually make it easy for people to access the vaccine. I have been made aware of a company in the city that has had a policy of making it easy for part of their workforce and having no flexibility for others. So I hope there's encouragement there for everyone to have fair access to it as well. Just on the question of the vaccines, obviously we've got a bit of a drop off in terms of second doses on those figures. Now, obviously we're working through it, but have we seen any issues in terms of supply that have come through, whether it's one form of vaccine or another, particularly whether we're talking Pfizer, AstraZeneca or anything like that?
Okay, so on your first point about employers, you're the second person today that's brought that to my attention. So we will be doing some targeted work with employers to stress upon them that, you know, people need to be given paid time off work in order to be vaccinated. But if anyone on the call or anyone watching is having difficulties with their employer, they can contact me confidentially, and I can follow that up with employers without revealing the source of my information. So people can whistleblow confidentially if they're concerned about their own workplace, and I would encourage people to do that, and I promise that we will follow up on those issues. In terms of vaccine supply, through April and the early part of May, there has been a bit of a drop-off in vaccine supply, in that as members will know, we have the regional vaccination site in York at Askham Bar, and we also have the GP-led vaccination programme as well. And so GPs have found that they've not necessarily received the number of vaccines that they'd ordered. And that's really because of a distribution problem. And it's quite normal in a vaccination program of this magnitude to see fluctuations in vaccine supply. It's rarely constant. And so what GPs have been trying to do, and certainly the vaccination centre at Askham Bar has been trying to do, is really focus the vaccine on second doses. So they've been working on trying to make sure that the people in the priority 9 cohorts, so the elderly and the most clinically vulnerable, they've been focusing all out on trying to get those people to be able to have 2 doses. And that has just meant a bit of a delay in people getting first appointments, and people finding that when they try and book an appointment, they're being offered an appointment in Leeds or Pontefract rather than York, for example. So I've been assured that those temporary glitches in supply should be resolved, and that we should start to see an increase in the flow of vaccines. And of course, we have 3 vaccines available now: Pfizer, AstraZeneca, and Moderna. If people have concerns about the AstraZeneca vaccine, then it's possible that their vaccination might be delayed if there aren't sufficient supplies of Pfizer or Moderna, for example. So we've got to that stage in the vaccination programme where it isn't as simple and straightforward as it was at the start. So that's just leading to a few minor delays. What I am confident about is that, you know, vaccine supply will continue to pick up. and anybody who wants a vaccine will certainly be offered one. And we hope to be able to get into the under 40 age group very soon.
Thank you.
Just sorry.
So go ahead.
Oh, go on. Yeah, sorry. Just the one with the supply. Has it been limited to one form of the vaccine, or has it been consistent across all the forms?
I don't know the detail of that, Councillor Heaton. The clinical commissioning group would have more information about whether there are any particular delays about one vaccine. I've not heard that there is one particular vaccine that is having more delays. The Moderna, of course, is the newest one, and so it's going to take a little longer for supplies of Moderna vaccine to build up. But I'm not aware that there are any particular problems with one. I can check, and if there is any data that I'm not aware of, then I can send an email around to members and just update you on that.
Thank you.
Thank you. Councillor Collett, please.
Yeah, thank you. And again, Sharon, thank you for a very clear, comprehensive and detailed presentation, as always, and for all your work over these many months now. I've actually got two questions, so if you'll permit me, I'll ask both at this point. The first is recognizing from the demographics, the age group which has seems to be accounting for a very large proportion of the number of positive tests at the moment, relating to our student population particularly. And we're now reaching the point in the year when students will be returning home in many cases. Does that pose any particular problems for us? And I'm thinking in terms of first and second doses, tracing numbers, and having any real grasp of what that's going to look like, because clearly we're measuring what's happening in York, but we could well be hitting the point where students receive one dose in York but a second elsewhere. I just wonder how that is being managed and whether it's posing any particular challenges. And the second is, it's really good to hear about the non-symptomatic testing and the encouragement that effectively we're all doing this twice a week. How is that going? What is the uptake on that? And given this is a public meeting, again, just to reiterate how we go about that, because I think many of us wouldn't have a clue, even at this stage. So if you could respond to those two questions, thank you.
Okay, thank you, Councillor Cullick. On the students issue, it is an area of concern. We've already identified this as a potential issue, and I've been having ongoing conversations in the university subgroup of the Outbreak Management Advisory Board for some weeks now, and I've been having conversations with GP practices locally as well. For any student who's currently resident in York, or who is studying away and returns to York, I'm confident that we can sort out their first and second doses. And because we're well into conversations about how we would facilitate that, including the possibility of pop-up sites on university campus to make it as easy as possible. However, I am concerned about what will happen to students who have their first dose in York and then have to have a second dose after they've returned home. And so all of that is going to be dependent on GP registration. So the messages that we're getting out to students at the moment is if they are studying and a resident in York, even in student accommodation, it's absolutely vital that they're registered with a GP in York. But if they have their first dose in York, or if they travel home, or they're living at home and studying remotely, they have to register with a GP at home, because it's only through GP registration that we can track who's had first and second doses. What happens outside of York is very much for local determination, really. But the message that we'll be giving to all students is some advice on what they can do if they have any problems, and who to contact in their area if they're having any difficulties, which will probably be the clinical commissioning group, because not all GP practices are necessarily delivering their own vaccination programme. But the clinical commissioning group will know who are doing vaccinations in their areas, because it's not easy to track down your second dose through the national advice line. And I've already had to help people who've moved into York needing their second dose access one, because the national system isn't sensitive enough to be able to cope with people moving around the country. So that is an issue, but I think we're already on top of that one as far as we can be anyway. In terms of the second question, we have one of the best asymptomatic testing offers in York. We have got 4 testing sites now. So we've got the library in Acomb, we've got the community centre at Foxwood. We have the partnership testing sites with York St John University and University of York still in place as well, and we still have the York Stadium. Those tests can be booked by going on to the council's website. There's also the Community Collect offer. And this is where it starts to get very complicated for people, Councillor Culloch, because there is various ways that people can pick up their own tests to do that at home. They can either book at one of our community testing sites to pick up tests that they can do at home. There are some community pharmacies that are offering Community Collect, and people can also go onto the national system and book tests online to be posted to them, and they can also ring 119. So all of that information is on our York website. So if people go onto the COVID pages, all of that information is there. What will happen with our York testing sites is a little bit uncertain beyond the 30th of June, because the government have only guaranteed funding for community testing until the 30th of June. What we have committed to, though, and this is going to the Outbreak Management Advisory Board next week, is that we want to continue to have a community testing offer in York, because not everyone feels comfortable in doing their own tests at home. And for people who may be visually impaired or have other disabilities, they may find it very difficult to do your own test at home, because you have to be digitally quite literate. You have to input your own symptoms, etc. So we're very conscious that some people want to continue to come and have somebody do their test for them or be supported with a test. So we've made a commitment to carry that on beyond the 30th of June. But until we have certainty around funding, we can't determine exactly what that offer will be. In terms of uptake, it's still very good. So we continue to monitor across all our testing sites the number of people who are accessing our sites either for a test or community collect. What we can't monitor at the moment is the number of people who are just going onto the national site and booking their own tests. But certainly we've got quite good uptake at the moment, and we have the regulars at our sites who are coming twice a week to be tested, and obviously that's something we want to strongly encourage.
Thank you, Sharon.
Thanks very much. Can I just check all the information that you've given us about the students? I particularly was asking about the students. That is being conveyed by the universities to that cohort?
Yes, yes. And there used to be a group meeting weekly looking at student health. I can't quite recall whether that's meeting weekly still or fortnightly, but we certainly have those meetings and those discussions taking place, and we'll be updating the Outbreak Management Advisory Board next week as well on the arrangements for students. I've also done an interview with student media, and we will be working very strongly with the university media as well, and with the student body to make sure that we get those messages out.
Thank you.
Councillor Taylor next, please.
Thanks, Chair, and thanks to you, Sharon, for this report, and to everyone who's been working on the ground to help us get out of this awful year. Let's hope it continues in the right direction. I've got a question that I think you can only partially answer, given the scope of your role, but I think you'll be involved in this to some extent, and that's with an eye to next week. So with the restrictions easing, from your perspective and the sort of conversations you've been involved with partners in the police and the council, and Safer York Partnership, do we think the city's ready? And by the city, I think I'm probably referring to the city centre, because inevitably, let's be realistic, there will be excitement and people will get merry, and rules might get bent by people and broken by people. And I guess I'm thinking, will there be an increased focus on the city centre to make sure people are still mindful despite their excitement with COVID marshals or street rangers? Has there been an increase in that resource, or have we moved it to focus on the area? You can sort of see what I'm getting at here.
Yeah. Whereas, first of all, I would say that, the whole city really has demonstrated one of our greatest strengths is how we've worked together to manage the pandemic and to keep our numbers as low as they can do. And even when we've had spikes in cases, we've been able to manage and contain that and bring case numbers low again, which is, so we know how to do this. And so I would say that we're as ready as we can be. There have been weeks in planning across all partners, including the police, including businesses, including retail, hospitality, our own COVID marshals, public protection team, public health, everyone who has a role in ensuring that the city can open safely. So I think we've done everything we can. We've with the COVID monies that we have been allocated for this financial year, testing comes out of a separate budget. We've already looked at, securing the contracts for the COVID marshals we've got in place. We've secured additional investment into environmental health, so that they have more capacity to do enforcement work. There's, daily meetings across the police and public protection, including the COVID marshals, looking at any antisocial behaviour or COVID related antisocial behaviour across the city. We've got lots of local intelligence that we're able to gather from lots of different sources, put that together, and give us a really good understanding of what's happening across the city. And up to now, businesses have been amazing in the steps that they've taken to ensure that their businesses are safe. And the vast majority of visitors to the city have also been very sensible. Obviously, coming out of this next phase, it is another risk. It's another step in the roadmap. We're very reliant on people's behaviours. So we've been working with the behavioural support unit at the Cabinet Office and our communications and the public health team. We've looked at all of our signposting, all of the messages that we can give to people. So I think we're as ready as we can. Our stance that we're taking is to inform, encourage, persuade, but if necessary, we will take legal action. And we're very clear on that, we have to keep residents safe. We have to keep people working in and visiting the city safe. And we won't hesitate to take legal action if we have sufficient evidence that people are flouting the rules. And so I can't give you 100% certain answer that we won't see any, unsafe behaviour. But what I can assure you is that we've got the mechanisms in place to be able to respond to that and address it if it should happen.
Thank you, Sharon.
Thanks very much. Councillor Hook next, please.
Thank you, Chair, and thank you again, Sharon. Echo everyone else's thanks. It's been a tough haul, hasn't it, the last year, and it's nice to see that we are sort of getting nice and low and good results at last, a more positive report than we've had before. I'm partly concerned about the testing, partly because I haven't had any tests yet, and I'm really scared about doing it. And I'm wondering how easy it is, because if you don't live anywhere near Foxwood or Monk's Cross, and especially for the aged people in residents in my area, how necessary it is. If you've had the 2 injections, do you think you need to have the 2 tests every week, especially because you tend not to mix with that many people? And I don't know how that's going, and whether that, because the chemist seems to be the best place to pick up them, is there a list of chemists that offer you tests to pick up?
Okay, so it is easy to do your own test if you have the necessary motor skills to be able to do that. You're confident in swabbing your own nose and throat, and if you're comfortable with having to use your phone or your computer to input the results, and so for younger physically able people, there's not a problem with doing that as well. We do offer in our community testing sites that the first time people are doing their own tests, they can come in and do it themselves under supervision from one of our testers if they want to. And certainly we've been offering that, and a number of older people, for example, have come in and taken up that offer. The point that you're making, though, I think is really important, and this is one of the reasons for the discussion at Outbreak Management Advisory Board next week, is how can we have what I feel should be a targeted asymptomatic testing offer. So if you've had both vaccine doses and you're somebody who has a limited circle of friends, then, you know, and you have a bubble, and, you know, you don't come into contact with loads and loads of people, then it probably isn't of much benefit to be tested twice a week. Whereas there'll be other people who work in roles where even if they've been vaccinated, they have lots of contact with members of the public. If you work in a supermarket, for example, or if you work in any other setting, where actually social distancing is very difficult, then I would encourage in those situations that people are regularly tested. So I think we're going to go back to the model of testing we had in York a few months ago, where we were doing targeted testing to people who were particularly at risk, rather than the government offering up asymptomatic testing to everybody. Everybody may not need it. And so one of the discussions we'll be having next week is, okay, if at the moment the government's paying for all the testing, if they were to restrict the funding for that, then we would move back to a targeted testing offer. And what would that look like? And what does our evidence tell us locally for who are most at risk? So we can reassure those and say to you, well, you probably don't need to worry too much about being tested twice a week. Obviously, people can do if they want to, but then a more targeted offer to help those people to understand where they're most at risk. So I can't give you a direct answer to the question, Councillor Hook. It's something that we need to work through, but you know, you were right to raise it. It's a very hot issue that certainly we're working through at the moment. And again, a community pharmacy won't be the answer for everybody, because you can pick up your test at the pharmacy, but they won't do the test for you. So it doesn't necessarily help those people who need that additional support.
Thank you very much.
Thank you. And finally, but not least, Councillor Warby.
Thank you, Chair, and thank you for the report, Sharon. My question's already been asked, really, from the Chair, but I thought I'd still ask it, and that is with the on the data of the vaccinations. You were saying that someone who's maybe vulnerable, or I don't know, an NHS worker who could be in the 40-year-old bracket to 49. I'm just concerned that you're getting double the statistics then, because they could both be in both, you know what I mean? So how can you have like the right figures, if you know what I mean? And then how can you work from that? Do you know what I mean?
Yeah,
Sorry.
yes, I know exactly what you mean, Councillor Wardby. This is national data. It's not data collected locally. So, so our GP practices, the clinical commissioning group, and directors of public health in local authorities all are able to access the same data. It's anonymous. For directors of public health, obviously GPs can access named data for their patients. But what we are doing at the moment in partnership with primary care, which may partly reassure you, is that we're working very closely with GP practices at the moment and have a data sharing agreement in place with them, that for anybody on there who's registered with a GP that hasn't been vaccinated yet, they're sharing that data with the public health team. And then we are able to, our contact tracers are then contacting those individuals to have a discussion with them about whether they, you know, why haven't they been vaccinated? Is it their choice, or there's some barrier in place for them? So that doesn't stop the double counting that we might be seeing in this data, because it's national data, there's nothing we can do locally to clean that up. But what we are able to do is, by working closely with GP practices, whether they're a health and social care worker, whether they work in a care home, or whether they're a resident, we can have those conversations with them if, according to their GP records, they haven't yet been vaccinated. And so we've kind of got a little bit of that ability to be able to check up. But even the council, as an employer, doesn't have access to the vaccination data for our own staff. It's all based on the GP practice that they're registered with. So that's kind of, by working closely with GPs in that way, that's the closest we can get really to trying to ensure that the data is most up to date. Because if we speak to somebody who's had a vaccination somewhere else in the country and their GP doesn't know, we can pass that information on as well. So that's kind of the best way we're trying to get around it at the moment.
Thank you very much. Everyone's had an opportunity to ask a question, so I think we'll move on to the next agenda item. Thanks very much, Sharon, for the presentation and your questions, answers. So it's agenda item 5 next. We'll probably take a short comfort break after this agenda item, if members are wondering. But it's the update on the peer challenge commissioned in adult services, and Amanda Hatton, our director of people, I think is the title, will be presenting this one. Afternoon, Amanda.
Hi,
or
everyone.
evening as it is now.
Yeah, I was going to say, is it evening or afternoon? It's always a difficult one, isn't it? Another presentation, I'm afraid. So if we can get that up, thank you. Okay, so what I'm going to do is talk you through what a peer challenge is, what we asked them to look at in York, and some headline findings. We have got a draft report now, but we haven't got the final report, and obviously we can come back in the future with the final report. So next slide, please. Okay, so a peer challenge is something that we request from the local government association, who coordinate these. So they do them all over the country, and they have a number of different offers as part of the sector-led improvement initiatives that they run and that they support. So it's not an inspection, and it's asking people who are currently doing a particular area of work from all over the country to come together as a mini team to come and look at the work that you're doing in that area. Find the bits that are working really well, and find the bits where there are more development, but also, really crucially, to give you suggestions, to signpost you to areas that are doing similar things to you that might be at a different stage in that development. So we asked the LGA, Local Government Association, to come and look at our adult social care provision, and particularly use of resources, which is one of the toolkits that they have. And the quite detailed kind of manual that sits beneath this is all available on the LGA website if people wanted to kind of look at the detail of that one. And the way that it works is we provide lots of information before the team comes on site, including a self-assessment where you rate yourselves against a number of indicators. And then the team spend time triangulating whether or not that information makes sense. So they check out what they've read, they speak to a whole range of different people, they speak to people who are using our services, they speak to people who are in receipt of direct payments and who are commissioning their own services, they speak to frontline staff, they speak to senior staff, they speak to elected members, they speak to partners, etc. So it's a really detailed programme. Next slide. We had a really experienced team when they came to work with us, and as you can see, so a previous DAS, recently retired DAS from Bradford, Bev, an elected member, and then service directors from other areas. And then what you always have in a peer challenge is a person who coordinates all that on behalf of the local government association. So we had Vanita, who's very experienced in undertaking this role. Next slide. So what you do when you're requesting a peer challenge is lots of conversations about what the key lines of inquiry are. Where do we want them to focus? What do we want them to look at in depth? How do we want them to do it? As I said before, a self-evaluation, a set of documents that you are asked to provide, which is quite detailed, a set of data that you're asked to provide, similarly detailed, and then the focus groups, etc. You then, when they've been on site, get an initial feedback presentation, and then you get a report later on. Our report's taken slightly longer because what we asked them to do was go into a fair bit of detail of where there were places that were similar to York, that were doing really well in some of the areas where we know we've got to develop. What we didn't want was just a report that kind of confirmed what was in the presentation. We wanted a report that gave us some signposting as to where we could go and people we could talk to. Next slide. Okay, so we asked them to look at quite a lot of things and to look in quite a lot of depth. So the first thing we asked them to do was to look at the People's Directorate, which has officially been in place since the beginning of April, but has been in place in shadow form since October of last year. And just to make sure that we'd identified where there were opportunities to improve our support to adults and where we could use the resources that we have within the Directorate more effectively. We wanted the peer team to look at our management of demand, particularly at the front door, but really importantly, think about how can we build on the strengths of individuals, strengths of families, strengths of communities to reduce the need for council support, particularly looking at that place-based approach and thinking about, are we working to the best of our ability with people who've got complex and often high cost support, and are they getting the right services in those areas? And that was particularly where we asked for some good practice examples from other authorities. Were we doing everything we could do in relation to commissioning and market management, and particularly thinking about the changes that are happening in health and the kind of potential going forward around joint brokerage, joint working with the CCG and then successor bodies. Next slide. Okay, so the headline findings. And as with all peer challenges, it's always a really, really positive experience to be involved in one, because you spend 4 days immersed in doing this work, and you get a really rounded picture of what's actually going on from all different stakeholders in service. And it's amazing how much detail the team are able to get to in a really short period of time. And this was done all virtually. They weren't doing any of this face to face in physical buildings. So the headlines are: we know ourselves really well, and our self-assessment was accurate, which is the first thing that you really want if you sit in my chair, is you want to know that we understand where we're doing things really well and we can build on that, but we also understand where we've got some development work to do and we need to continue to build. They were impressed that we've got a really clear vision, and that was not just around the People Directorate and what that was going to deliver, but how that fit as part of a wider council vision. So that was really positive. They saw a learning culture and a commitment to learning in place across staff and partners, which was really good. I think for me, the most important two were that they found really motivated staff who had felt supported, which was fabulous. And also people that we work for were positive about the staff that they were working with. And there was evidence of this strengths-based approach to practice starting to embed. More to do in terms of the embedding, but you could see it in practice. Some strong partnerships that had strengthened during COVID, which we've talked about before at these meetings, and new structures starting to build on that. So the advent of the Alliance was seen as positive. They saw committed leadership at all levels of the organisation, and that included elected members, and really saw a commitment to driving forward services and making sure that we're on a journey of continuous improvement. And really excellent work during the pandemic, especially with care homes, which picks up some of the points that Sharon's been making before. So some really positive headlines. in the context of an incredibly difficult year for all of us, but particularly for adult social care services. So, you know, everybody that's involved in delivering those services, supporting those services, should really be heartened by the positives. Next slide. What they also found, and not surprisingly, is people are tired. And, you know, it's certainly one of my concerns is that people have worked above and beyond during a pandemic and are now working to deal with what's happening post-pandemic and the impact of that pandemic. And, you know, when do we get to give those people a break? When do we get to give our staff a really proper break and some downtime? And how can we do that in a context of rising demand? So there's been a lot of change, especially at senior leadership, and particularly in relation to the statutory DAS role. And that had been an issue across the piece, but particularly around lots of change for frontline staff, because those new DASs had come in and had different visions, and that's a challenge. That what we need to do now is to translate the vision that we've got into a simple plan, and actually be really clear that we can't do everything at once. That in the context of a pandemic, in the context of how tired people are, what we need to do is be really realistic about what we're going to do, when we're going to do it, and what it's going to look like when we've done it. Particularly what we need to do is to strengthen performance culture and some of the information that we have available to managers so that they can more easily do their job. So if I was to reflect on my children's services side of the directorate, what managers in children's services have now is a really simple, user-friendly dashboard that gives them the key information they need to make sure that their services are on track, and catches them before some of those services start to go off track, so you don't get delay. We haven't got that in the same way in adults, and that's one of the things that we need to really build. And also look at what opportunities do we have as a consequence of the pandemic, but also as a consequence of different partnership arrangements, to think about how we can commission and manage the market differently, and look at what services we might need in the future that might be different to the services that we've got now. Next slide. So the next steps are to do something very similar to what we've done in children's services, which is the very simple, straightforward development plan that I've just talked about, which is a smart plan, very clear about what the outcomes are, very clear about how we're going to measure them, and very clear about our trajectory. Also think about how we're going to give social workers and frontline staff some time out to think, reflect on the impacts of the pandemic on them and on the services that they provide and on everybody that they work with. Make sure we carry on incentivising preventative work and making sure that we really understand what works and why. So a lot of the evaluation work that we've done, you know, a lot of the stuff that Pippa's talked to you about before in terms of some of that really effective frontline practice. How can we build on that? How do we continue to do that? Stronger links into some of those corporate systems, so things like business intelligence, better information in that area, more accessible information in that area. How can we use technology to complement services, but not necessarily to replace them? And that was a really strong message from the peer team, was use it as part of what you're offering, as one part of the menu. And making sure that we continue with a very strong message, which is home first and not care home first, which I think is something that we've been very successful with. And again, Pippa might want to comment on this later in terms of supporting hospital discharge, but also really supporting very, very effective work with the provider sector during the pandemic. And in order to support all of that going forward, what we are going to do is develop an improvement board, which again is exactly the same as we've got for SEND, for children's social care as well, which is a multi-agency partnership board with a critical friend sitting on it. And I've asked Moira, who's the regional rep for the LGA and ADAS, to be our critical friend on that board, so that we can make sure that the plan's on track, and that we continue on our journey of improvement. And I should really say that a journey of improvement is not saying that there is anything wrong with services. All services can continue to improve, and all services should be striving to improve. So outstanding services should have improvement boards, because outstanding services that don't continue to improve don't stay outstanding for long. And the most important thing that they fed back to us, that there is lots that's going very well in York and lots of positives. So don't see improvement as a negative, see improvement as one of those positives. And part of that culture of learning and looking beyond our boundaries to best practice elsewhere, and making sure that we build on the positives so that we don't lose them. That's it. Next slide.
Okay, thanks very much for that, Amanda. We'll go straight to questions. Councillor Taylor first, please.
Thanks, Chair, and thanks for that whistle-stop report, Amanda. I've got a question that I hope you can answer at least partially prior to the report proper being published. And it's around the sort of points on staff being tired, which won't be a shock to anybody in the current climate. And this idea of trying to find more, if you like, time and support for social workers. And I mean, to me, it's that time and support and staff being tired are linked. But then I think, how can that tangibly be addressed given the pressures that these services are under? I just, without even being close, I know how much pressure these services are under just by hearing reports like this on a periodic basis. And I just think, how can we do that? I mean, even if we had improvements in technology, the pressures would still be there. And could those improvements deliver material enough changes in space to help staff out? I'm just interested in your thoughts, really, because without being too cynical, and I know you're not going to say this, what I'm getting at is it'd be nice to hear something much more meaty and tangible than, you know, staff having the occasional coffee morning together or whatever. That kind of thing.
You're right. It's not about staff having a coffee morning. It's about what you build in to the workforce systems around them. So what was really positive about the peer review was that the frontline staff that they spoke to, and they spoke to a variety of frontline staff, said that they felt supported, and that they would know where to go for support and would know who to talk to if they felt they needed additional support, and would know where to access that. Social work is a profession that deals with very traumatic, difficult circumstances and situations all the time. So as a profession, we have got systems in place that are about how do we do that. So we have supervision in place, which is more than a one-to-one with your manager. It should be about reflecting on what's going on for you, what's going on in work, and how the two come together. You know, what does what you're working with bring up for you? How are you managing that? What support do you need? What are your learning needs? What are your development needs? That, on the children's side, we've done a fair bit of work around reflective supervision groups, and that's gone down really well. And around support programs around our newly qualified practitioners to make sure that they're very well supported in their first year in practice. So we have things like a social work academy, which is around that initial period in practice, which is now working across adults and children's. We have a principal social worker in both adults and children, so we're now working together around those kind of practice circles, those practice groups, which is that safe space where staff can come together and say, actually, that was really hard, and that was a really difficult thing to go through, and it wasn't easy, and I didn't like it, and I don't want to do it again. Because actually that's really, really important, and it's a big part of what we should be doing as a profession. The other thing we have done, though, is recognise that even if this is what you do and you are used to dealing with difficult circumstances, there is something much more significant about the year, 18 months that we've all been through that has been much more difficult, and we have to name that and we have to recognise that. So one of the things we've done with partners is have some specialist development and specialist support work for staff around managing trauma and the impact of trauma. And it's a member of police staff who's used to working with serious trauma incidents, who's done a number of workshops, and that's gone down really, really well. in terms of helping staff understand the impact that it's had, not feel guilty that they don't feel okay, because actually not being okay is okay. You know, and actually sort of thinking about some of that. And then on top of that, we've got obviously all the kind of corporate offer, but we've also done like things like a wellbeing week. We're doing wellbeing sessions. We had at one of our DMTs, we had the chaplain come and do 10 minutes of mindfulness at the beginning of the meeting, which was just a really lovely thing to do. But you're right, Councillor Taylor, it isn't a kind of, here's one thing. It is a collection of things, and different things will work for different people, and different people will like different bits of that. But there is an expectation that everybody who works in those services will be part of supervision, will access that, will access that support. We have worked hard to make sure people are taking leave. That's been quite difficult because actually some people didn't want to take any leave when you couldn't go anywhere. You know, it was kind of, what do you do when you just, there's nowhere to go? But that's been really important, you know, and kind of modeling that as a team. You know, Pip has been really, really, really good at being very open about, you know, it's really important to take leave, and how much better we as leaders have all felt when we've come back from leave, so that people feel like they've got permission to do that. And the last bit that we've done, which sounds small but is big, is putting at the bottom of emails that I might send you this email out of hours, but you don't have to feel that you need to respond to it outside of your hours. Because for some people, if they're working around, you know, their home life, they might want to send an email in the evening because that's actually less stressful for them. But nobody should feel like they have to answer it. Nobody should feel like they've got to work at weekends if that's not their core hours. And just trying to get that message through. But it's not solved, and it's something that we'll continue to have to keep an eye on, because it's hard working in these services, as well as fantastically rewarding and amazing. It's hard work. And people are tired.
Thank you, Amanda. Really appreciate that sort of suite of answers. And it is a small thing, but I do like that little note at the end on the email. You know, it's one of those things where flexibility in the workplace is increasingly demanded across all sectors, but it very rarely works both ways.
Yeah.
And if that flexibility can apply for the worker too, then it's really helpful. So thank you. Cheers.
Thank you. I think I noticed a couple of minutes back, Councillor Heaton indicating, did you have something you wanted to say that was relevant to this question?
It's actually already been picked up, thanks. It was about encouraging people to take leave. But right. If I could just say one thing quickly, while we're here, Amanda's there's talking about bringing stuff in from the Children's Directorate, and you know, having been on that committee for the last 2 years, you know, if we can bring that stuff into adult social care, that's, you know, that can only be a positive in terms of turning things around and building things up.
And I think that the same is true the other way around as well. So one of the things that came through the peer review and is strong in adult social care is around that strengths-based practice and that kind of work with communities, which is something that children's social care is starting to build. So there's a real opportunity as part of the People Directorate and as part of that kind of learning across for everybody to pick the best bits of what's going on across the directorate, which for me is the really exciting bit, that there's, you know, some really good practice across the piece and everybody can learn from each other.
Thank you. Councillor Culloch, please.
Thank you, Chair, and thank you, Amanda. It won't surprise you that I was going to ask a very similar question to Councillor Taylor, because I appreciate what a demanding time this has been. And in that context, I think I would want to congratulate you in undertaking this peer review, because it's not something that was compulsory in any way. I would have thought that it would have been the easiest thing over the last 12 months to say, well, we really don't have time to be doing that. So to have been undertaking that peer review during this time, I think you should be applauded for that, and that should be noted. And I will pick up on a slightly different question, although the very full answer you gave to Councillor Taylor's question, I really did appreciate it. And I think there was a lot in that that really we need to pick that up in other directorates and maybe even as councillors, in the way that we work and how we relate to each other. And I was particularly encouraged with the reference to with the chaplain to the council, because there's hardly ever any reference to the chaplain to the council. But that is a role I had myself for many years. That was my introduction to working with the City of York Council. And I know that that Peter Horsley has been doing a tremendous job in support over these months. So I just thought I would give him that name check as well, because he does deserve a mention, and he's been doing great work. So thank you for all that. What I will ask, however, is you've recognised that coming out of this pandemic and into the next phase will bring its own challenges. I wonder whether you could articulate how you see those challenges, because I would be interested in your answer. This has been such a difficult time, and I know that it will have had a huge impact on physical and mental, emotional health, and particularly amongst older people who, okay, a year will have brought, 12 months will have brought deterioration for many physically and mentally, but I think that will have been exacerbated. Is that what you're finding? What is it? What are your anticipations of the additional demands upon the resources, the systems, and the staff?
Can I just apologise before I answer that question if there's a slightly odd sound in the background? My dog is asleep and just started to do a kind of weird barky dream bark. So if there's sort of weird squeaks, it's just him. So apologies. His name's Ernie, if anybody's interested. It's a really good question, and if Sharon's still on, she might want to come in on some of this, because one of the things that we're all doing as directors of adult services, children's services, and public health is try and answer that question. You know, what do we think comes next, and what do we think is going to happen? And there are some modelling tools, and there are some predictors that we've talked about around the kind of path of COVID, but then also the path of demand post-COVID, which we're looking at. And it is mixed. That, you know, some of the things that we all thought would happen, i.e. we are seeing a rise in demand around mental health services, and we are seeing people who need those services who maybe have not been near those services before. We're certainly seeing that. And we're certainly seeing that in adults and in children's services. We are certainly seeing some of the physical impacts of just being in, not being out, some of the kind of muscle deterioration in some people. So, you know, the kind of increased tendency to fall if you've not been out walking and doing some of that. But also we're seeing people who have survived and survived well, and who can take some confidence from the fact that they've done that. You know, some people who've thrown themselves into, you know, the kind of joke about the couch to 5K is the most downloaded app, but that some people have actually had that opportunity to do different things with their lives. So it's really complicated to think about what does that modelling look like. What we do know, though, is what Sharon was talking about before, that we have got people now who delayed seeking medical attention for other conditions, who are now waiting for those conditions. And it is about how do we support them to wait well, and how do we support them to build on some of those skills and capacity they might have developed during the pandemic in terms of that coping strategy to actually cope with that as well. So there is modelling work going on, which Sharon's doing more of than I am, which is around trying to pull all this together and think about what might our scenarios look like in the next 3, 6, 12 months, particularly in relation to winter. And then what do we need to do to make sure that we're ahead of them and that we can survive them? Sharon, do you want to come? Is there anything to come in on that?
Yeah, I mean, I would agree with everything Amanda has said. So what my team, the public health team, are aiming to do is work with colleagues across the city. So, you know, obviously with Amanda's team, but also our NHS colleagues, to try and come up with kind of single vision for York of what we think the next 3, 6, 12 months might be like. As Amanda's already mentioned, there are lots of different modelling tools available, but we need to be speaking with one York voice, which is what we've been trying to do throughout the pandemic. And so that work is ongoing at the moment. The hospital is involved with that, TÜV's involved with that as well. And we're hoping that by the end of this month, we'll have some scenarios that we can share. So we have a best case scenario, worst case scenario, so that when we're looking at our business continuity plans, we can think about the worst scenario that we might need to prepare for, and then what we think is the most realistic, so that we can try and get a city view around that. What I think is probably clear, though, is that we will probably see another surge in cases as we head into autumn. But if the vaccination program continues to go as well as it has been, we won't necessarily see the impacts that we saw previously on the NHS, but that the impacts might be broader social and economic impacts. So, you know, the impact on children and students, if we see a high number of cases in schools or in students and we're having to isolate school bubbles, so that might have an impact. If we see large numbers of outbreaks in any particular businesses, then single businesses might need to close. People might need to self-isolate. So it'll be a different sort of pandemic picture going into this winter to what we had last winter, is almost certain. The caveat around the worst case scenario for the NHS and Amanda's area, particularly adult social care, is we don't know what's going to happen with flu this year. So for the winter just gone, the coronavirus knocked out seasonal flu. So we've seen hardly any flu at all through the last winter. What we don't know is if we have lower levels of coronavirus circulating in the community, will flu make a comeback? And a bad flu year always puts enormous pressure on the NHS and adult social care. So that's one of the worst case scenarios we're trying to model through at the moment. And whereas normally we look to see what's happening with flu in the southern hemisphere to give us an idea of what's likely to happen with flu in this country, because their winters before ours, because of the way COVID is working across the world, we're not necessarily going to have a very accurate prediction of what seasonal flu might do for us. So in Amanda and my head, and in the head of our NHS colleagues, we are starting to think about, well, what might a bad flu season look like, and how we're going to manage a bad flu season if we also have COVID circulating. So that's kind of the worst case scenario that we're trying to work through and prepare for.
Thank you. So many unknowns.
Thank you. I'm not seeing any other indications currently, so I'll go on to, I've got a question myself, and I'm going to give a little challenge to one of the headlines, or two of the headlines that I think potentially might conflict a little bit, but you might be able to explain. And also a suggestion or something I'd like to see going forward. So in terms of with my question, and it's all in the headlines section, the bullet point, motivated and supported staff. Would you say this, does it tally with staff survey returns and current sickness rates? Can you make any comments about those?
Yeah, sickness rates are variable, and they tend to be better during the pandemic than they ordinarily would be. So certainly on the children's side, we've seen significantly less sickness than we ordinarily would do. I think that's
might that be related to more home working, do you think?
Yeah, and I think that's equally concerning, because I think that then what you get is people that actually shouldn't be at work and should be ill, who are in work because they're at home. So, you know, that kind of conversation we had before about how do we make sure that we're all looking after each other and that we're looking after ourselves is, you know, yes, sometimes if there is a difference between working at home when you're not feeling great and actually getting in your car, driving to work, or getting on the train, driving to work and then doing it. So sometimes you can, but if staff are ill, then they need to have permission to rest and get better and be well. So so sickness rates vary and have those caveats with them, because they do seem better than ordinary. Yeah, staff survey results. Again, we get positive feedback around how staff feel supported by their managers, and that's really about first line managers, and that's a kind of a shout out and testament to the work that, particularly during the pandemic, the first line managers have done to make sure that their teams are feeling supported, which isn't easy when you change to virtual work and you can't sit together in a team in a room in the way that we used to do. So some of our managers have done some really innovative and brilliant stuff around how do they make sure that they're keeping in touch with their staff. So that came from the mouths of the staff that the peer reviewers talked to. You know, there was staff focus groups that didn't have any managers in. They talked to those staff and the staff were honest. Nothing's attributable in a peer review. So if you go to one of those meetings, it doesn't say in the report, you know, Amanda Hatton says, it doesn't attribute any of it. So, you know, it is a safe space to share that you're not feeling okay as well as that you are.
Okay, thank you. And the two headlines that I thought might conflict a little bit were the one on strong partnerships and new structures developing to build on this, and he gave the example of the Alliance, along with a lot of change, and especially in senior leadership. And I thought, well, how do they go together? Because if there's been a lot of change, then have we lost some partnerships, for example?
I think the change related very specifically to the number of directors of adult services that have been. So obviously there's been a change in that I'm now director of adult services as well. The advantage of it being a twin hatter, as we call it, so somebody that's got the director of adults and children's services, is that a lot of those partnerships were already established. So with the children's hat on, I knew all of the partners in York, because clearly I've been working with those partners in York, so they're not having to get used to yet another person that comes into that role. You know, I've worked in lots of different places, and I think the partnerships in York are very strong, and they are of a different level post-pandemic, or as we are coming out of the pandemic, hopefully, than they were at the beginning, and they've always been positive. People are very engaged in those partnerships. People come along to those partnerships. I think there's an honesty in those partnership relationships that have arisen out of the pandemic. And for me, and it's a personal view, but part of that has been that we've all been working our way through something that we didn't know what we were working our way through together. So there's something really kind of empowering in a partnership that you all have to say, none of us have got the answers to this, because you don't have. So you have to create those answers together. And that puts everybody on an equal footing in doing that. And that sort of willingness to do things differently. And, you know, and again, I would flag up the work that's been done, particularly working with the care home sector, and the work that Pippa and her team have been doing with Sharon and her team, around finding really creative and innovative solutions to working effectively with that sector, which has been brilliantly successful for us as a city. But that has been about that investment in that partnership working, and that kind of honesty in working with partners. And I think that does stand us in good stead. I mean, the kind of anecdote that I keep saying, but it is true, is that throughout the pandemic, we had on a Wednesday morning a senior leadership meeting with key partners first thing in the morning, and we would sit there and eat our muesli together, and kind of one of us would have been for a run, or one of us would have done whatever we'd done. And there's something about sharing that when you're trying to find a solution together that actually builds you as a team, and we can't lose that going forward, because that's given us a real strength in terms of an honesty of relationship, and having challenging and difficult conversations, and not being scared of doing that, but actually building that strength in those partnerships going forward, that I think is really important.
Okay, thank you, Amanda. And then finally, as part of the next steps, and this might be something, and I'm hoping you're going to tell me this is the kind of thing we're going to see as part of it, the last bullet point on establishing an improvement board. So what I would expect to see there, or within it, are some metrics. Absolutely. So basically about some specifics and name specifics, and kind of periods for when we would expect change, or and any officers that are responsible for affecting this. So that's something tangible, shall we say, to come out of it all. So I'm hoping the report will reflect what they might be.
Yeah, I think that's really, really important in terms of what the plan looks like. So it's not a great big weighty tome that's got lots and lots of actions in it. It is exactly as you've said. It's focused, it's relatively short, and it articulates what it looks like when we've achieved it, and what the stages on that journey are. The other thing that, it's an approach we've used on the children's side, and it's worked really well. The other thing that we've done on children's is we've got a kind of plan on a page as well, so that everybody understands what the plan is and where their part in delivering that plan is. And that was developed with frontline staff, and that's really important, because it needs to be a plan that everybody owns. So yes, absolutely, simple plan, clear milestones, a data dashboard that goes with it, a quality assurance framework that goes with it, and reports that come out of that we can all integrate to make sure that we're all on track and we know where we are. Okay,
well, thank you for that. And I think that's probably an appropriate point to move on. It's 19:21 currently. If we have a short comfort break, I'm guessing members will want that. And if we can come back, say 5 or 6 minutes, should we say 19:28? Not a specific time. And we'll crack on then. Okay. Good evening and welcome back to the next part of this Health and Adult Social Care Policy and Scrutiny Committee on the Tuesday the 11th of May, and we're about to start agenda item 6, the update on the all age learning disability strategy, pages 9 to 14 in the agenda. And I'd like to welcome Pippa Corner, the Assistant Director, Joint Commissioning for the NHS, Vale of York CCG and City of York Council. Good evening, Pippa.
Hello, thank you.
Hi. I'm guessing members will have had a chance to look through the report that Pippa's provided, but if you want to give a brief introduction, if you wouldn't mind, Pippa.
Yes, certainly. Thank you for making time for this. I suppose where we left off the earlier discussion is probably quite relevant to some of the content of my report, because as we've been talking about, the pandemic has been really the main focus for over a year for adult health and social care, and for that matter for social care for children and young people as well, in terms of lockdowns and social distancing and changes to the way that services operated where people need services, but also limiting some of the social opportunities that people normally relied on and enjoyed as a means to a fulfilling life. And community capacity has been obviously very significantly affected, as has the workload of colleagues across the system in health and social care. And I think what's important and significant about this update is that it really highlights that we haven't been able to make the progress we expected to make in relation to the published strategy. So as the report reminds colleagues, the strategy was ratified by the Health and Wellbeing Board in March 2019. It runs until 2024. And we had a really lovely event at Priory Street in October 2019 to sort of officially launch it with our community. And that event, you know, involved quite a bit of celebration, a lot of interaction and engagement from different groups and individuals with an interest in learning disability. And clearly by that, I also mean people with lived experience. It's been my privilege while I've been in York to co-chair the Learning Disability Partnership with Claire from People First, but also Becca and other members of People First who've been part of the partnership and have been very active. And we were looking to expand that engagement and to hopefully enlist one of the family carers to help co-chair and to sort of move it forward so that it stopped feeling, I suppose from my point of view, like perhaps a more old-fashioned partnership board as they used to be structured. But we haven't met in the real world since that time, since the pandemic started, and we've just recently in March this year had our first renewed partnership, which we did over Zoom. So in the report I kind of mentioned there are some things that haven't happened and some things that we've done in the meantime, which we fed back to partners at that meeting in March. So the strategy has these 4 key strands: education, lifelong learning and employment, being healthy as possible, independent living and participating in society. And each of the priorities had a sort of working group to focus on them. And they were just getting off the ground as the first lockdown started. So as the report sets out, each of those areas had identified a number of things they wanted to work on and hadn't fully formed as groups, so they were hoping to attract more people to get involved, and unfortunately that was not possible to continue with in the old way during lockdown. And I think it's fair to say that some of the staff time that would normally have gone into supporting the development of the strategy and supporting implementation and holding meetings with partners was focused on the very urgent crisis response to the pandemic itself. It doesn't mean to say that we've done nothing about learning disabilities during the pandemic. And as I say, so we talked at the partnership about some of the things that have been happening. During the first lockdown, the council commissioned Toolbox to deliver activity boxes to people at home and in a accommodation where people have support. So that was a different way of trying to deliver some day activities. We worked with United Response to deliver a meal service for those in the community who might have struggled to get healthy meals. And some of our day service providers, switched to working through Zoom, and also for those people where that wasn't helpful or wasn't sufficient, also did doorstep chats. And we've seen that in other customer group areas as well, such as dementia and older people services too. So having some contact, although obviously in a socially distant way. The social work team's been making welfare calls to people and with learning disabilities and to their families. And we've now started to open up some activities again, with services trying to operate in a COVID safe way. And obviously that guidance has changed over time. So the other thing that is requires a lot of attention to detail is making sure that individuals, families, communities, as well as services are really up to date with whatever the latest guidance is. And that included sort of ensuring that people knew that there was some easing of restrictions last summer, but then also going back into lockdown. We've had a fairly limited short break service over the period, but that's been starting to open up again. And we've done some work to try and make sure that people access information technology. We know some people still find that very difficult, but actually one of the things that's been quite educational for me is the number of people who really have adopted information technology, not just old Luddites like me, but families and individuals with learning disabilities have been obliged to get to grips with technology and meeting over Zoom and such like, but also have found it's helped them keep in touch with others. One of the things that we were obviously, understandably concerned about was whether there were people who were getting very left out as a lot of activities moved on to social networks and social media or to platforms like Zoom. And we did a bit of a survey through the advocacy group about that, which we didn't do it on IT. We did the survey through letters to people using our networks and anonymous responses back to the advocacy group. And we arranged for the printing and envelopes and such like through the council. And actually an interesting and significant number of people were making really good use of information technology. So in some ways that kind of gave the lie to some of my expectations and prejudices about that. However, we know that significant numbers of people haven't really taken to technology and haven't found it as positive as just ordinary contact with people day to day. Some of our council services in terms of the community outreach service has been running throughout the pandemic and offering that vital support. Pine Trees has opened up again using government guidelines. And there's some current ongoing review about community-based greenworks and pastimes. So some other service has been opened at that site while the review is finished. So as I said, we met in March using Zoom. We gave a presentation about the strategy and the work that hadn't started and the progress we had made. And we asked partnership members just to think about, are the priorities still right? And is there anything else that we need to pay attention to given the amount of time that's passed? So the strategy group, which sits under the partnership, has met again, and the leads of each group are starting to get their groups back together and consider any actions that need to happen. I think the partnership discussion highlighted these sort of 4 key areas, which I don't think will be surprising to anybody. So definitely a big focus on social isolation, how we stay in touch with people and keep them informed, so making sure our communication is really up to scratch when we can't easily get together, how we support people to participate in society, and thinking about how communities and services have both changed during the period of COVID-19, and then thinking about how we make sure that we hear all the voices and engage with families and individuals and make sure that where we have some consultation that needs to happen, that's timely and is done in good order, really. So these key priorities will then sort of sit across with the rest of the strategy work, and we'll try and make sure that we join up the areas, because there are overlapping areas and linking areas across the 4 main themes, and those 4 principles I think will inform how we work together. So I think I would summarize it as it's good news and bad news in some ways. We haven't been able to make as much progress as we would hope, but the principles, so for example, the focus on education and employment as being the key pathway for young people preparing for adulthood, and for older adults who are interested in developing their skills and maintaining a link to workplace, including voluntary work, but also significantly paid employment. That's still really important, and that hasn't changed. And it's those sorts of issues that we're going to need to renew our energy for as we come out of lockdown and services are restored. But in that context, what I would have added to the discussion that happened earlier on about services and staff being tired, it's absolutely true. And for all staff, we have a number of different priorities that we're trying to juggle in terms of doing things correctly coming out of what's changed during the pandemic, returning to and restoring services that existed before, but also testing them out and trying to evaluate whether they are still the right model, and whether they were good enough in the first place. Did they meet the needs in the first place? Is now an opportunity to come back different. So in Sharon's report earlier on, she had that bullet point about building back better and fairer, and there is an opportunity to do that. The partnership itself is a very good network of people who share a common interest in getting the best possible outcomes for and with people with learning disabilities in our community, and valuing their contribution. So I'm confident that the spirit of the partnership will go in the right direction. But I suppose I have some apprehensions that the workforce has many, many different priorities that we've been set. And so if it's all about the workforce, things will take longer than we might have hoped in the first place. And for our community of people with learning disabilities, they also need to build confidence back, to have a chance to meet up again, enjoy friendships, enjoy social connections, as well as meaningful activity and making this difference to our society.
Thank you, Pippa. Members' questions, please. And we'll start with Councillor Heaton and Councillor Taylor, please.
Thanks very much, and thanks for this, Pippa. Just a couple of things there, really sort of following on from the last couple of things you said. I mean, in terms of the work that's been done, looking at point 12 there in particular, I mean, what are we are we at a point where we can say, this has worked well and we're going to take this forward, or are we still assessing that? And particular practices that have come out of the whole pandemic period.
I am not up to date immediately on the day-to-day operational services. So point 12 in terms of the whole range of activities that we've done in relation to learning disability services, I think we've had good outcomes from a lot of those schemes. But I think what I heard when we had the discussion with partners and people with lived experience was they want to get back to social connection. They want to get back to being able to meet people and meet up. And in fact, we were really quite excited just meeting on Zoom, because we hadn't all been in the same space together because we're an unusual network. And if you can get excited about being on Zoom after not seeing each other a year, then we definitely know we need to get back to that sort of face-to-face community connection. I think if you think about the infection and prevention and control measures, some of the services where people get together in groups, we're going to have to think about what does that look like in a COVID safe way. So have we got all the right sort of, hygiene and infection prevention and control mechanisms in place, because it'll be a new way of working. I suppose a bit like teachers have had to adopt completely new ways of working, going back into the classroom with pupils. Not to say it's insurmountable at all, and there's certainly plenty of advice and guidance around that, but it's just going to be different. I also think that we don't know as a country, maybe as a world, we don't know exactly what the impact on the economy is going to be. So when we're thinking about people having access to meaningful paid employment and voluntary employment, actually we're all still thinking through what's the world going to look like. So I don't know the answer really to what will happen next, but I think it'll be incremental steps. We do have quite good communication networks, certainly with people that use services. Perhaps there's a bigger question about how do we reach out to those people who aren't in touch with adult social services, because one of the real strengths about this strategy was that it was not focused on services. The whole purpose of it was to really think about how does a person with learning disabilities in York live a good life, and that should, as far as possible, be outside of services and not dependent on social services. But that also means we don't have that ready-made relationship or connection with them.
Sure. I think what you said there about, we don't exactly know where we're going to end up with this. It sort of links into point 16 really, in terms of, it's going to be a difficult balancing act really in terms of planning, because we're going to have short-term consequences, we're going to have long-term consequences. I mean, in terms of timescales, I'm looking particularly at point C, the participating in society section. I mean, given the length of the tail that we're going to have with this pandemic, are we sort of like very aware of that risk of sort of like dragging on before we develop a full plan, or what's the balancing act we're going to be operating on there?
In relation to the strategy, I think the structure of the strategy is fairly clear in terms of there's the 4 key sort of priority themes, and they break down into a number of different areas for action, and many of them around collaboration and campaigning and enabling people to do things for themselves. Some of them also do have an investment consequence if we were going to be able to deliver it, and I think it will be a bit of a balancing act around where these activities are going to be reliant on paid staff to make them happen. Then the reality is that our workforce is still reprioritizing work and still making sense of what has to happen next. So I think we will be able to deliver the spirit of the strategy. I think we will easily assess whether things that we're planning to do are in line with the principles and the spirit of people having their human rights protected and supported and promoted, whether we are thinking clearly about an inclusive human rights city. Those sorts of things really important to this agenda, and we'll be able to test that out as we make progress. But if services are thinner on the ground, or if people can't access them for as many hours a week, for example, as they might have done in the past, they may still feel that they're not getting their fair share. And I think we'll just have to work our way through that and be really attentive to the feedback that we get.
Yeah, but we do have that flexibility to move as things develop then.
Yes, we do. Yeah.
Good. All right. Thank you very much.
Chew toy. So if you can hear any weird crunching, that's my dog. He's got some bone or something. Anyway, sorry. Thanks for this, Pippa. My question is around engagement and involvement of those living with learning disabilities. In terms of the strategy subgroups, how many people who are living with learning disabilities are actively involved with this? It's hard to. I mean, I read the report, and a lot of the stuff in there is positive, and I accept the struggles that COVID has brought about with it. But it's hard to. There's just no sense of numbers really.
Yeah, that's a really sensible and positive question. Thank you. And now that you say it, it's not clear in the report. So we have a small, I would say a small network of people with lived experience with learning disabilities, and also carers, family carers of people with learning disabilities, who are very actively engaged in attending events and helping to run events, putting on events in the city. And they are connected to some of the groups that have been operating in the city. So colleagues might know about York People First, which was a long-standing, very well connected and networked group, and they've done things like the People's Parliament. They've done those numerous times, and that's been a source of really valuable insight. Now, when that small group of people coordinate and convene a parliament, it brings together lots of other people who are either less well known to us or not known to us at all in terms of services. Similarly, the advocacy group or something like Brunswick Organic Nursery, they come and they're very involved in some of the meetings, but it's still a familiar group of people. And this is true of any organisation, really, isn't it? It's dependent on meetings. You get some people who are happy to attend meetings and like to make a contribution in that way. And then you have a wider audience of people that we have to reach out to. So within the development of the strategy, I guess we've had perhaps around 20 people who've been very active and very consistently involved from different organisations, maybe between 20 and 30 over the time that I've been involved with it in the last sort of 2 to 3 years. But actually, when we had the launch in October, if you can picture the main hall at Priory Street, it was quite alarming because it was absolutely packed with people from the back of the hall right up to the front of the stage, and there was not enough space for people because everybody knows somebody, and it was well connected, and a lot of people came together to be part of that. And I would say, you know, probably the majority of people, more than half, were people involved in learning disability services who themselves had lived experience of learning disabilities. So for me, that was a really exciting and enjoyable event. But I don't meet those people all the time. In my job, I don't see those people all the time. And it's about using those natural networks and those relationships. Because let's face it, not everybody wants to know me. That's not the point of having a good life, is it? So what we have to do is use our connections and our community networks to try and make sure that we're engaging and hearing from people. And that's why partly we did the thing about trying to check out who's using smartphones, who's using iPads, who's using laptops, as well as who can answer letters and pick up information that way.
Thank you. Any final questions, members, at all? I'd just like to ask something on section 8, the being as healthy as possible section on page 10, Pippa. Mm-hmm. And one of the bullet points is how to raise awareness across the city and involve GP practices with this. What was the answer that came out of this? Are you able to say, or was that something that we've not been able to progress yet?
Yeah, so I think there may be a punctuation issue there, because I think that question relates to the annual health checks, the regular health checks in primary care that are fundamental to supporting people with learning disabilities in their health. So there's an NHS target and a measure for GPs carrying out learning disability health checks every year. And it's always been one of those problematic areas where if we put in a lot of effort, we get good numbers, and then it very easily slips back down because it only takes another couple of months to go by and people have missed that yearly milestone. So it's not like your car's MOT where you get a reminder, and if you don't follow it up, you can't drive it anymore, or you get a fine. This is something where everybody knows it should be annual, but actually quite often it doesn't end up being annual, just for all the human reasons. And I think one of the things that has happened that was really positive in York in the last few years is that the CCG worked with primary care, with GPs, to actually have some roles dedicated to highlighting learning disability health checks and making sure they happened, and kind of coordinating them and getting people into practice. And that was seen as very positive. The world's moved on a little bit and things have changed, but we do have a number of GPs who are very focused on this and very interested. So I think the answer to that question, I would say, is probably to sort of harness the motivation and energy of those GPs that are already really on board and get them to raise awareness with their colleagues, because I think GPs listen to each other really well, and it can be quite infectious when you get somebody that's really passionate about it and can explain what a difference it makes. But we know that people with learning disabilities are one of the groups who experience health inequalities, where they don't get access to all the right advice, and they don't necessarily access all the screenings and tests that they would have otherwise. They're not the only group that experience exclusion from health services, as we know, but it is an important group. And some of the work that we're doing, and Sharon and our colleague Peter Roderick, I think, has possibly spoken to you previously about population health management, and some of our areas of priority, and the intelligence that we've gathered sort of tells us how to target people with learning disabilities along with some of those other excluded groups. But our excitement and passion and commitment is reducing inequalities and tackling inclusion, the need for inclusion.
Thank you. And in terms of summary, really, I know there's no recommendations to the report, but I do think with something that's presented in the future, we need to be able to see quite clearly, and again, it comes back to the metrics that I asked about before for the peer review stuff, in terms of, what needs to change. We need to be able to see what needs to change easily, by how much and when, and what the impacts of either failure or success are. I'd like to see that those are really clearly highlighted in future, because what I don't want is for something to, and I'm not saying it is at all tokenistic, but for this to have value, I think we need to see those points quite clearly. But thank you very much.
Thank you. I think it's partly a matter of timing, Chair. I think the request for this report came fairly soon after we'd had the first reconvened gathering. We've talked earlier on about the impact the pandemic's had on all of our workloads and on staff capacity. So I think this gives you a bit of an idea of where we've got stuck, some of the things we've been able to do, but as you say, it doesn't give a clear picture of what we're going to do next. And that's because for me at this stage, I feel like we're still just emerging from that big cloud of the interruption that the pandemic has caused.
Fair comment. Yeah. Okay. Thank you very much. Thank you. All right. So we'll move on then to the work plan. Item 7. Now, okay, I've printed some papers. I shouldn't really perhaps have printed them. It might have been easier with sticking to the other screen, but the next meeting, which is towards the end of June, is an informal forum. So I'm guessing we'll have Sharon will give us another update in terms of the COVID response in the city. That's valid at that particular time, and of course, all being well, that will literally be the day after, I think, the next uplift of the stages of coming out of lockdown. So hopefully we'll be still progressing at that point. The next public meeting of Health Scrutiny is towards the end of July, on the 29th of July. I know, Amanda, you mentioned, or I think sort of suggestion that the peer review report would be ready in around about 6 weeks or so. So it might be that the July meeting might be an appropriate point for that report to come, that we can pencil in that date for that, 29th of July. If that's it, do you think that's reasonable to expect that one?
Yeah, because you'd want the action plan to go with it as well, wouldn't you? So, and the metrics. So, yeah, that makes sense.
Okay. Councillor Taylor?
Thank you, Chair. This idea's only come to me tonight, following on from Sharon's initial presentation. But I wondered if for the next proper health scrutiny in late July, it would be of value and tangible to get a report, I don't know, maybe from the CCG on how the health system is dealing with the backlog across different types of health needs, be they mental and physical, anything from knee surgeries to cancer treatment. And I think something like across the board like that with numbers and comparing the waiting lists post-COVID to beforehand, I think that would be really interesting and useful, and also give CCG and any providers the opportunity to talk about how they're going to try and navigate out of this. I mean, obviously, we could put together a detailed scope between ourselves by email after this meeting, but we get a lot of reports that come to this forum or committee, sorry, that I find it hard to get my teeth into, but something like that would be quite timely and measurable, because more and more people are talking about this backlog. I don't like that word, but you know what I mean.
Yeah.
And we have the time to do a clear scope for whoever we might want to put that together.
Yeah, entirely reasonable and sensible suggestion, I think, for a public meeting item. Louise, would you be able to pick up that with the health partners, with the CCG and potentially the hospital trust as well, I would say?
Yes, yeah, that's fine. I can pick that up.
Right.
I don't know if Sharon's just come on, so she might have something to say.
Yeah, I was just going to suggest that involving the Mental Health Trust would be useful in that as well. I'm happy to work with you, Louise, in identifying the right people for you to contact. But I agree, it would be a really good agenda item.
Yeah, in terms of TUV, who obviously provide most of our mental health services in York, you'll probably recall last month we, following a discussion I had with their director of operations, that they'd had some work to do following the CQC report, and it wasn't specifically about York, but some of the other locations that were inspected, but work that will be relevant to York. Now, the Director of Operations, who's really keen to come to Health Scrutiny, is actually on annual leave when the July meeting sits. And obviously she would be the key person potentially from TUV to feed into this kind of work potentially as well, Sharon. So we will know in terms of her availability that she'll not be able to come to July, and specifically about what we were going to ask them to come for. I was hoping that members would be happy for that to come to the following public meeting, which will be the November one. How would members feel about that? Is that would that be agreeable with members? Yeah, I'm seeing, I think, indications that yes. Obviously, we'd want the senior officers to come from TUV, and obviously July, like any of us, we could have all be on annual leave then. In terms, it's not unusual. So I think I'd be happier for her to come in person as she would herself for that. So we'll pencil that in for November. But certainly, if we can ask the CCG and the Hospital Trust to come and report on the elements that Callum's suggested for July, I think that would be good. I'd like also Sharon and Amanda to discuss with members of the team about some of the agenda items that we've listed already, because we've got quite a substantial list of items for consideration, and I think we need to start bringing some forward. Appreciate that that it's been difficult, and it's difficult with people away from West offices. I understand from me and Floyd that we will start to get some of the team coming back to West offices, although not everyone all at once, and it will be a long process, I think, in staff returning. But hopefully that will mean it will be easier again to start to doing some of the work in terms of preparing items for scrutiny. I'd like to be able to see some of the dates populated with agenda items. So if that could be discussed amongst the team, and I think I'm hoping members would be flexible on what comes forward from that list over the next few months. But obviously, if there's anything urgent, then please do drop us a line, and we'll happily consider and discuss with officers about what we can bring forward. Likewise, if there's anything that you think suitable for the informal sessions, there's certain items that I certainly would want to see in a public setting. But if there are any items for the informal meetings, and including next month, then please do make that suggestion to us. Is there anything else members want to raise at this point? Councillor Culloch.
If we've come to the stage of closing this meeting, I would just want to say how much I'm looking forward to actually seeing people again. And some of our meetings are happening in person, including planning meetings. And we will have our annual council in just a short while, where unfortunately there will be restrictions on numbers and not all of us will be there. But for those who are, I'll look forward to seeing you. And for those who aren't, I'll be sorry to miss you. As you'll be aware, there are always changes with membership of committees with annual meeting, and it may be that some who are in this meeting are not continuing with this committee, I don't know. But I won't be, at least for the next 12 months, and I just wanted to say how much I've enjoyed and appreciated being part of this committee over a number of years now, and hopefully I'll be rejoining in 12 months, but you won't be seeing me here for the next year. So thank you, Chair, and thank you, members of the committee. Do appreciate how much this committee does. It's such an important part of the work of the City of York Council and the work in the city. And there have been some really good developments, and I think and hope and pray that the positive things that are happening now and some of the positive things that have come out of these awful times will really serve us well in the future.
Thank you very much, Councillor Culloch. It's been a pleasure working with you over these last few years while you've been on the committee. I don't know whether I'll be chair next month, or whether I'm on the committee. That's not my gift. But certainly in terms of the next 12 months for yourself, I'd like to wish you, and I'm sure members on the committee would join me in saying good luck as the incoming Lord Mayor, and best of luck. I'm sure you'll do a great service, and thank you.
You can imagine how I'm looking forward to chairing full council meetings. Hopefully back in real meetings where we're all in the same place and
indeed
not sitting and looking at screens.
Okay, thank you very much. Yeah, oh, I was just reading a chat message from Councillor Taylor.